When kids just won't listen, parents often feel stuck between two choices: to give in or get angry. It's exhausting. We give you the top techniques directly from the experts, helping you on your path to a more peaceful, respectful, and joyful life with your kids. Today on the show, Dr. Kathie Williams is someone who makes health education into fun learning experiences for kids. She works at EdVenture, 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 and that's a children's museum and learning center that gets kids moving. It has a lot of hands-on tasks and incorporates role play and experimenting in their labs and programs. Dr. Williams has 30 years of public health experience. She's worked in Africa with kids who are malnourished and has done so many things, including nursing education, developing health literacy materials, and has also helped refugees who have settled in the United States to access healthcare. In the show, she describes how she designs programs to keep children engaged, and how she communicates the rules and instructions, and introduces us to whole body listening. I'll let her tell you about it. Without further ado, Dr. Kathie Williams. Right. Kathie Williams, welcome to the show. Thank you so much for joining us today.
Thank you for inviting me, James.
We're excited to learn about you and your work at EdVenture. You've been there since 2007, it says here?
Yes, that's right. February of 2007.
Yeah. And you'd also mentioned working with some children in Africa. Can you say more about what that work was?
Yes, I was a nurse educator in the Democratic Republic of the Congo. Right now it's in the news because there's an outbreak of Ebola going on in the country. And I taught maternity and pediatric nursing to nursing students who were at the hospital where I was at that time.
Wow. So you're teaching the nurses how to be nurses?
Right.
Okay. And now you have a doctorate in health promotion, education, and behavior. Is that right?
That's right. It's a public health degree from the University of South Carolina, the Norman Arnold School of Public Health.
So I hadn't heard of that before. What's kind of a typical role for someone with that specialty?
The nice thing about health promotion and education is it's pretty much everywhere, but that would be what I do here at EdVenture is I would plan programs that would be health related, anything to do with health, wellness, nutrition, and safety. I do a good number of those. So it might be heart dissections in our bio lab, cooking programs in our cooking lab, other outreach programs that we would do that would have to do with health, wellness, vaccinations, all of those sorts of prevention kinds of subjects. So we at EdVenture really believe that education is for everyone, and you cannot have, particularly for children, a child that's not healthy will not be able to learn. So our health education is right in one of the pillars of what we do. So pretty much anything to do with health or nutrition.
And that education is for the children? It's directed at the children, or is the family and parents there too?
Oh, family and parents are always involved. A child doesn't learn, in a vacuum.
Yeah.
They learn in families, and families are the first and biggest teachers. So we frequently pitch it towards families of the children that are with us.
Okay. So you have both. You have, school buses showing up with kids, and then you also have families.
Oh yes,
yeah.
We have them coming in groups or as individual families. They can come here for birthday parties, for overnights, for camp, for series programs. We really try and provide programming in ways and in times and places that the kids are and their families are looking for. So the whole month of February, focus on heart health and dental health. So that we call Take Heart and Smile. So there'll be a teddy bear clinic and lots of physical activity and characters that are people dressed up as characters. Anything that will engage a child and help them think about something about their own health.
Well, you've been working with kids for a long time. What is it that you love about working with kids?
Oh, wow. I love how so often kids want to share their information. If they've learned something new or fascinating, they want to pass it on, and they want to tell you about whatever topic interests them at that very moment. So I think that's what I really like, is how curious and kind most kids are about sharing information. As we get to be adults, I don't know that we're quite as ready to do that. So I love the way they are resilient and curious and ready to interact with the people in their environment. And they always surprise me. They make me laugh.
Oh, yeah.
I usually learn as much from them as certainly as they do from me. But I will just laugh later on because something they said is so pertinent to so many things in life. So they're surprising.
Yeah. When you talk about learning from them, is there any specific lesson that you find yourself learning from kids?
Well, I can remember some times. I'm trying to think of a good answer for that wouldn't. I'll just tell you, a little 5-year-old one day told me, "If you be killed, you be dead,
That's
and
true.
you not be live, you be dead."
Mm-hmm.
And I mean, she just went on with that it had occurred to her, the finality of death, and she was only 5. I have no idea what sparked that, but well, it really made an impact on me because it was a revelation to her, and she wanted me to know that too. So that's not a real positive one. I also little kids, we were doing the Apollo 13 anniversary, and I said, "Oh, wow." And we were in an elevator that was made like a space module, and he just volunteered. He said, "I know how to walk like a spaceman." And then he modeled it from the whole way up in the elevator, and he was absolutely right. It got into weightlessness and the quiet of space. And so we had this lovely little science lesson in, the minute and a half that it took us to get from the bottom floor to the top floor. So I guess that shows more about what they teach, because if we listen, they are looking at information that we may have gotten so long ago that it doesn't surprise us anymore, doesn't give us anywhere to jump off from.
Right. And he's teaching from a kinesthetic and joyful place that grabs everyone's attention.
Yes.
Seems to work.
Oh, and there's so much joy in it that I think I like that as well. If I had to say, the joy of healthy children is something adults could use more of, I guess.
EdVenture in Columbia has been around since 2007. Can you tell us more about...
Go
ahead.
All right. Well, EdVenture has been around, as you say. It was the brainchild of some moms that got together and realized that we didn't have anything quite like a children's museum, and in this case, it's more of a learning center. So they got together and basically from a grassroots sort of a way built this museum. So when we're at when you come to EdVenture, we are an informal learning center, and we allow children greater variability in how they learn. Yes, we do South Carolina standards-based school and group programs. We have to because teachers have such a limited time. They couldn't come and spend the field trip time and money if we didn't cover those South Carolina standards. But we do cooking and nutrition classes, gardening programs, oral health programs, and we have a museum apprentice program for older elementary and middle school students. So whichever age group or content area, the EdVenture programs strive to be fun while you're learning. Actually, it's kind of the opposite of that. Is if it isn't fun, then we are doing it wrong.
Right.
And so that lends itself to being a noisy, messy, engaged sort of a learning environment that frequently looks, to an untutored bystander like a little bit of chaos.
Right.
But the teacher is in charge and they're learning a lot. It's not chaotic. It just looks noisy, messy frequently. But the programs at EdVenture are all designed to teach while you're enjoying what you're doing.
How did they come to that kind of first principle of this needs to be fun? I mean, it's not a playground that you're running. So how did that get put into the mission? Do you know?
I believe from the founding mothers and the first CEO and our current CEO, all of them are very committed to that as a goal. How we did that originally, I'm not exactly sure, except for the fact that many people have seen young kids that are loving learning, and then if you just wait a few years till they're in formal schooling, they don't have a lot of that joy. So we really felt like that if children were loving learning, which is the way I think it's supposed to be, that they would be learning more. Now, who thought that up and how we got to that, I wasn't here that long, although I've been here a long time. But I know that in the very center and the core of this, at the foundation, all of that joy and love of learning is front and center, very integral.
Nice. And you've helped start a couple of labs at EdVenture?
Yes.
What are those? Mm-hmm. What goes on in one of the labs?
Well, the BioLab, which was the first one that we set up, is a chance for children younger than high school and college. Some kids never got a wet lab experience until they were well along in school. And if you aren't really introduced to science as a hands-on occupation or activity, you're probably not going to be as interested in it when you are choosing college majors, that sort of thing. So our BioLab allows kids as young as 2 or 3 to have a wet lab experience where it's hands-on. We may be dissecting a pig's heart, not for 2-year-olds. They would be probably looking at flowers and plants. We might be extracting some DNA from cheek cells so that we could begin to see how science, biology, and, well, we also do earth science as well. There was one yesterday, we made slime because we were looking at non-Newtonian substances. Anyway, this makes it's fun. Everybody went home with a bag of slime that they had made, and they were then thinking about some concepts in science that they probably, wouldn't have had an opportunity to do without a place that could provide that experience. And We can do it. We can take the mess. We have the ingredients. We have the educators who can teach those classes. So those were fourth graders yesterday that were making the slime and learning about substances. We have others that are very early engineering practices for 3-year-olds, where you take a book like Three Billy Goats Gruff, and we learn about the science that's in there. And the kids even do some coding with our codapillars, which are little toys that look like caterpillars, and the kids can program them to turn left or turn right or go forward. So we're introducing concepts that are going to stand these kids in good stead when they get further along and will be ready to take other opportunities because they've had these early experiences here at EdVenture. It's a good place.
When you have the fourth graders, for example, in the lab, how many are in a room at once? Are they with the teachers are there, and how many facilitators?
We can take as many as 25 in our bio lab, and I neglected to mention our cooking lab, and I will go on and tell you about that. Uh-huh. But the teachers would be in there because they can help facilitate and expand the learning, answer some questions, and then we will have a certified educator that will be teaching the classes. We have the education team has about 5 of those people in that role, but we all teach classes, so depending on how many students we have. If you had, say, a larger group than that, we would break them down and do the same class in multiples so that everybody would have the, one-on-one or at least a little bit more of a small group experience than just a huge demonstration. Everything that we do in our labs is hands-on. In the cooking lab, that is something that we opened a little bit later, I believe 2013 or 12. I'm not sure. I'd have to go look that up. But that is a lab which is set up like a demonstration kitchen. We might have 3-year-olds in there learning the Very Hungry Caterpillar and making a parfait and learning about the colors and the order that you put it in there and what he ate on a Monday. And so they're getting a literacy focus, but they're also learning about dairy and fruits and vegetables and why the ones with the dark colors are so good for you in a fun way that they then get to eat what they made. But we might also be doing Global Chef for an older kid. That one I think is 8 to 12. And there they would be learning about the country that various foods come from and trying out the techniques and the culinary techniques that it would be required to cook. And that one would be a little smaller because we have 2 chefs here, Ashley and Kenny, who are wonderful, ServSafe trained, as well as they both have education backgrounds, as well as a nutritional therapist background in Ashley Hutto. So we teach those classes in the cooking lab with a slightly smaller number, although we've had our camps get very filled up, so sometimes we might have more than the 25 in there, but we do try and limit the numbers for the experience.
Let's talk about some of the challenges that you all face when you have a room full of kids who are playing with the slime, or I know you have all types of things for them to interact with. You were saying that one of the common kind of problems is that kids might just be blurting out kind of comments or inappropriate comments or making jokes and distracting the others. Was something we had talked about earlier.
Yes, and that's an ongoing. They get excited. Yeah. To gain the attention of a group of children who are not listening, the basic, when you pare it down, is stop the activity, whether you say everyone freeze ring a bell or a buzzer or however you do that. Stop the activity, refocus the attention, whether that be 1, 2, 3, pause. Let me see your pause, which works, and then hold your hands up. Let me see your eyes. Sometimes there's a clapping rhythm that it's a call and response that gets them refocused, and then give new directions. Make them simple and doable. Have the students reflect them back to me so that we can check for understanding, for example. And we're going to use our walking feet to walk down to the restroom. All right, are we using our running feet? No, and they will come back and tell you that no, walking feet. So you then check that everybody has understood that. Let's see, you check for understanding. And I would say probably another very important thing is deliver your instructions in an assertive tone of voice that expects to be followed. Now, I'm not saying aggressive or mean, but if you believe that you are worthy of being listened to, then it's much more likely that the kids will listen. And if you believe they will do as you direct them, they are more likely to do as directed. And I would act out the motions if that would be helpful, like walking feet versus running feet, or sitting with your hands, folded. It's a good time to do some of the whole body listening techniques that are out there, where you listen with your eyes and your ears and your hands and your heart, and your feet are still, and modeling those and reminding them again about that technique and those standards.
Can you tell me more about what the whole body listening is?
Whole body listening is, I'm not sure who set it up, but it's a technique where you listen with every part of your body, and you have to, if the ears are listening, the eyes are listening, the mouth is quiet, you are looking at the person usually, then even your heart is listening, because you're thinking kind thoughts about the person who's talking. You're not ignoring them. Yeah. There are a lot of charts and such on the web that can help you see those, how to keep your feet still, your hands usually in your lap or folded or something, so they're not easily disrupting your neighbor. And that whole body or total body active listening is something that can be learned even by very young children, and actually that's a good place to start.
Okay. Do you have any specific methods on how you would work with a kid into learning that? Because it sounds great, but I'm wondering how, if a kid hasn't heard of that or isn't into it, how you're selling that.
Every time that you hear something like, let's all sit crisscross applesauce sitting on the floor, that helps them to control their feet. When you say, let me see your eyes, then you're redirecting them. This is teaching piece by piece, whole body listening. And what I'm trying to say is, you don't have to hit them with the whole thing. You can teach them parts of it. Keep your hands in your lap is actually a way of stilling that part of your body, so the rest of your brain and your eyes and your ears can actually take in new information. And sometimes it's just letting smaller kids have a chance to move around again, because they can't sit still forever. They're just not designed like that. And it's not even healthy. We all should get up every now and then, especially once every hour, to move around. But all of those techniques where you're saying 1, 2, 3, pause, let me see your pause, meaning your hands, and holding up your hands, is teaching them the technique of whole body listening. I guess that's what I'm trying to say. You don't have to hit them with the whole thing at once. You can just add it as you go. Okay.
So when you have a group of kids that's getting difficult to control, you're having trouble getting their attention, you're saying the first thing you would do is try to kind of get the whole group's attention. You mentioned ringing a bell, something that's...
Freeze. they love freeze because they've done freeze tag, and a lot of them have. And anything that stops the activity so that they can reconnect with you as the teacher, or with the activity that you intend to happen.
And then
now, sometimes you're going to have. I'm sorry. Go ahead.
Well, I was just going to go on to the next step, but I'm curious what you were going to say.
Well, sometimes when you have a total meltdown of a child that's just not able to cope anymore, that's a slightly different, a different situation.
Sure.
One of my colleagues, one of our chefs in the cooking lab directs everybody to do breathing exercises, and she does those for about, I won't go into what each of them are. And then she goes back to continuing the class, because what that's done is sort of cleanse the brain and the mind, and then allows them to refocus on what she's trying to teach. Sometimes having the child's classroom teacher, if they're in there, help out by asking the child who's disrupting the class to go sit by the teacher, or sometimes I've even had a chaperone or another adult to take the child to we call it a safe place here, to spend some time away from the group. It can be just in a corner of the room, but it allows them to kind of get out of whatever is stimulating the behavior, to figure out what the child wants to do and how the adults in the room can help him or her develop the self-control that he or she needs to come back to interact with the class, not as a punishment, but more as a way of getting out of the stimulating environment enough to be able to pull yourself back together, get that self-control, and it helps the child develop greater self-control than just being directed by the teacher. So sometimes those meltdowns, you do have to kind of remove the child from whatever is causing all the stimulation.
Right. You had mentioned using an assertive tone as compared to contrasting to an aggressive or mean tone. And I know that that's something that is very subtle. A look, a glance, a little sharpness of tone, and that I think we all have been guilty of slipping in a little something too mean, whether we're talking to a partner or a child or anybody. Do you have any tips around monitoring that, or how we can do that better?
I think if we practice the whole body listening too, I mean, how many times have you been in a meeting or something where you're figuring out what your rebuttal is going to be to somebody's talking, that you don't really listen. I find that if I'm in the moment, and that sounds very nebulous, but modeling that kind of good behavior, in other words, I know you're going to listen to me because I know that what I have to say is important, but I'm also going to listen to you and respect your needs and wants and contributions. It's more a mindset, if I had to just sum it up, about meeting these kids where they are. And on a day when you aren't on your A game, then that's all right. That comes back to their resilience. They're not going to hold it against you forever. They'll give you another chance to try again. Okay. So I know many classroom teachers would say, don't smile till January. But I would say, don't be nice. Don't be nice at the start. They'll walk all over you. I think that's wrong. We always try here to model kind, respectful behavior for your students. And firm and assertive just means that you know what you're doing. So, of course, they're going to want to hear this because it's something they're going to want to know. That's just assurance that you know what you're doing. So I think there's a fine line there.
Yeah, and when you said to know what you're doing or to know that what you're saying is important, I think the flip side of that is, or another way to say that might be not kind of wasting words. I feel like
short and sweet is best.
Yeah, I know that, when I'm upset or I see people who are upset and they kind of launch into something and they'll say the same thing 5 different ways.
Right.
That's generally going to invite the person to tune you out. You think you're reiterating it because it's so important, but really it's losing its strength every time.
Fewer words as possible with covering what it is that you need to say. Yeah. We find sometimes body motions, if you can turn it into something they can watch, that they're more likely to understand and listen to you. So sometimes it gets to be almost a full sense onslaught of what you're trying to get across. I've watched some of mine that look like circus performers because they're very good. My colleagues here, they're very good at saying it, facial expressions, changing tones of voice, even if they're losing the attention of the class, just getting back to a whisper, because sometimes that can actually get the children to listen more closely. So I think there's all sorts of bags of possibilities in your bag of tricks. Sure. And I learn more and more as I watch my colleagues here who've been doing the teaching a little longer than I have. So there's always something to learn from other teachers.
What advice do you hear that you feel like people should be wary of or people should not follow? Is there something simple that you feel like people should stop doing?
That one's a tough one. But the one that I came up with when I was thinking about that is, they say always set your classroom rules and your expectations and early from the beginning. Sometimes we find here that if a teacher has come in with a different set of classroom rules already, that setting our own is sometimes counterproductive. For example, if you have, this happened recently, like last week or so, the teacher had her whole class, they had numbers. So instead of saying, Susie, line up after Johnny, after Robert, after whatever, it was 1, who's 2, and the kids knew their numbers and they got right in line.
Wow.
I don't think I would ever give kids numbers, but for that teacher, lineup was perfectly simple. So we used her rules that those kids were already familiar with. And so I think it's sometimes knowing when to insist on your own classroom rules and when to say, well, this has been working perfectly well, we'll just follow this. So sometimes I think that idea of following set classroom rules and expectations, sometimes you need to be ready to modify that depending on what has already been familiar for your kids.
Yeah.
But I think that one is the one that I see for the most part. I'm sure there are many others, but that one is one that I came across last week.
Right, and when you're setting expectations early, if you think that that's going to accomplish it, well, then you can write a whole handbook.
Yeah.
And a lot of kind of institutions do that. They're trying to anticipate every problem, which, especially for young people who aren't going to read that handbook or anyone, that can set us up for disappointment.
For certain, or just for losing some of your instructional time because you're dealing with classroom management or behavioral issues, that sort of thing. You want to streamline those as much as possible.
What are some of your favorite resources that you would recommend to parents or educators?
All right. Other educators, I'd have to say, first of all, Taylor and Kendall and Kenny and Ashley and Matt and a number of others Lindsay, that I wouldn't even mention. They are the best resource that I have found here because they're a laboratory. They are trying these out, testing them, retesting them, modifying what they need. So I'd say other teachers that you admire. But for resources, particularly for parents, I like kidshealth.org. That's by Nemours. I'm not sure I'm pronouncing that right, Nemours. It's an online information site. They have portals for kids, for teens, for parents, and educators. And their topics range on everything from how to talk to your kids about important health subjects, drug, alcohol. They'll also have some on, say, asthma, childhood obesity. But then they also have ones on how to get your homework done. And one that I really, that's interesting me right now is for teens on how to navigate the healthcare system. And that's a program for educators, but we tend to release kids into adulthood without having some of those skills, such as being their own advocates for healthcare. So that's one that I find I go to pretty much every day for information that I need.
Okay. Kidshealth.org.
Yes.
Where can we learn more about EdVenture or any of the events that you are a part of?
Thank you for asking. I tell you, right now we are getting ready for the New Year's Eve ball drop, and that will be at noon, New Year's Eve at noon. And then in the first of the year, on the 11th of January, we open our Snowville exhibit. That gives kids in South Carolina who may not get to see snow very often a chance to have a cold weather experience indoors. So Snowville's coming, and all of this can be found on our website, which is edventure.org. And then you click on one of the three sites for which you're most interested, and that will give you a monthly calendar, upcoming events, camps, a variety of other things that you could find useful just for every day, but also for what's going on here at EdVenture. So I'd send you to our website,
Great.
First off.
Great. Do you have any parting thoughts before we say goodbye?
I wish you luck, and I have thoroughly enjoyed talking to you about how to get kids to listen. It's always a goal, even if we don't always succeed every day. But it's well worth the effort. And I thank you for asking me to talk.
Thank you. We'll put links to all the things that you talked about in our show notes, and those will remind people where they can find EdVenture in Columbia. There's also a location in Hartsville and Myrtle Beach. Is that right?
That's correct.
Okay. Well, Kathie, thank you so much for your time.
Thank you, James.
And everybody out there, thanks for listening.